Does someone you know or yourself suffer from the following diseases? High blood pressure, type 2 diabetes, heart disease, stroke, abdominal obesity, and abnormal lipid cholesterol and triglyceride levels. Polycystic ovary syndrome (PCOS), irregular menstrual cycles, cysts on the ovaries, fertility issues, non-alcoholic fatty liver disease (NAFLD), cardiovascular diseases. Most likely, the root of the problem is insulin resistance. Watch this video and you will see the relationship between this disease and insulin resistance. Insulin resistance is a condition in which the body's cells become less responsive to the effects of insulin, a hormone that helps regulate blood sugar glucose levels. When cells are less responsive to insulin, it leads to an impaired ability to take up glucose from the bloodstream. This condition can contribute to various health problems, including several diseases. Here are some diseases associated with insulin resistance. 1. Type 2 diabetes. Insulin resistance is a key factor in the development of type 2 diabetes. As cells become resistant to insulin, the pancreas produces more insulin to compensate. Over time, the pancreas may not be able to keep up with the increased demand, leading to elevated blood sugar levels and eventually diabetes. To understand how insulin resistance can lead to type 2 diabetes, it's important to grasp the normal physiological role of insulin and how disruptions in this process can occur. Normal insulin function. When you eat, especially carbohydrates, your digestive system breaks down the food into glucose, a type of sugar. In response to the rise in blood glucose levels, the pancreas releases insulin into the bloodstream. Insulin's primary role is to facilitate the uptake of glucose by cells, allowing them to use it for energy or store it for future use. Insulin resistance. In individuals with insulin resistance, the body's cells such as muscle, fat, and liver cells become less responsive to the effects of insulin. As a result, cells do not efficiently take up glucose from the bloodstream, leading to elevated blood sugar levels. Compensatory actions to compensate for the reduced effectiveness of insulin. The pancreas produces more insulin in an attempt to bring blood sugar levels back to normal. Beta cell stress. The increased demand for insulin over time can lead to stress on the insulin-producing beta cells in the pancreas. Decline in beta cell function. Continuous stress on the beta cells may eventually lead to a decline in their function. They may become less able to produce sufficient insulin to overcome insulin resistance. Persistent hyperemia. As insulin resistance progresses and beta cell function declines, blood sugar levels remain elevated for more extended periods after meals. Type 2 diabetes diagnosis. The persistent elevation of blood sugar levels eventually results in a diagnosis of type 2 diabetes. In summary, insulin resistance creates a situation where the body's cells do not respond properly to insulin, leading to higher levels of glucose in the bloodstream. While the pancreas initially compensates by producing more insulin, over time, the beta cells may struggle to meet the increased demand. The combination of insulin resistance and impaired beta cell function results in persistent hyperglycemia, which is a characteristic feature of type 2 diabetes. 2. Metabolic syndrome. Insulin resistance is a central feature of metabolic syndrome, and it plays a crucial role in the development and progression of this cluster of metabolic abnormalities. Metabolic syndrome is not a single disease, but a collection of interconnected risk factors that increase the likelihood of developing cardiovascular diseases, type 2 diabetes, and other health issues. Here's how insulin resistance contributes to metabolic syndrome. Insulin resistance as a core component is one of the defining features of metabolic syndrome. In individuals with metabolic syndrome, cells throughout the body, particularly in muscle, fat, and liver tissues, exhibit reduced responsiveness to insulin. Compensatory hyperinsulinemia. To overcome the resistance and maintain normal blood glucose levels, the pancreas produces higher amounts of insulin. This leads to a state of hyperinsulinemia, where there is an elevated level of insulin circulating in the bloodstream. Effects on lipid metabolism. Insulin plays a role in lipid metabolism, promoting the storage of fat in adipose tissue and inhibiting the release of stored fat. Insulin resistance disrupts these processes. The result is an abnormal lipid profile, characterized by elevated triglycerides, decreased high-density lipoprotein HDL, or good cholesterol, and often an increase in small, dense low-density lipoprotein LDL particles. Pro-inflammatory state. Insulin resistance is associated with the chronic, low-grade inflammatory state. This inflammation contributes to various aspects of metabolic syndrome, including impaired glucose metabolism, lipid abnormalities, and cardiovascular risk. Prothrombotic state. Insulin resistance is linked to an increased risk of blood clotting abnormalities, creating a prothrombotic favoring blood clot formation state. This further elevates the risk of cardiovascular events. In summary, insulin resistance is a central factor linking the various components of metabolic syndrome. The combination of insulin resistance, central obesity, dyslipidemia, high blood pressure, and other metabolic abnormalities collectively increases the risk of cardiovascular diseases, type 2 diabetes, and other health issues. Lifestyle modifications, including regular physical activity, a balanced diet, and weight management, are crucial for addressing insulin resistance and managing metabolic syndrome. 3. Polycystic ovary syndrome (POCOS). Insulin resistance is strongly linked to the development of polycystic ovary syndrome (POCOS), a common endocrine disorder affecting people assigned female at birth. POCOS is characterized by hormonal imbalances, irregular menstrual cycles, and the presence of small cysts on the ovaries. Here's how insulin resistance can contribute to POCOS. Increased androgen production. Hyperinsulinemia contributes to an increase in androgen production by the ovaries. Androgens are male sex hormones, and elevated levels can disrupt the normal balance of hormones in the body. Impact on ovarian function. Higher levels of insulin and androgens can disrupt the normal ovarian function, leading to irregular or absent menstrual cycles. Follicular development and ovulation disruption. Insulin resistance and elevated androgens can affect the development of ovarian follicles, small sacs containing eggs, and disrupt the process of ovulation. This can result in the formation of small fluid-filled cysts on the ovaries. Hyperandrogenism, increased androgen levels contribute to the symptoms of hyperandrogenism, including acne, hirsutism, excessive hair growth in male pattern areas, and male pattern baldness. Impact on insulin sensitivity. Insulin resistance itself can exacerbate the hormonal imbalances seen in POCOS by contributing to higher levels of circulating insulin. Elevated insulin levels can further increase androgen production. Association with metabolic anomist. Insulin resistance, which is often a precursor to metabolic syndrome, is commonly seen in individuals with POCOS. This association underscores the connection between POCOS, insulin resistance, and metabolic disturbances. Management with lifestyle changes. Lifestyle, including a balanced diet, regular exercise, and weight management, are often recommended to address insulin resistance and improve symptoms in individuals with POCOS. It's important to note that not everyone with POCOS has insulin resistance, and the exact relationship between insulin resistance and POCOS can vary among individuals. However, addressing insulin resistance through lifestyle changes and, in some cases, medications can be beneficial in managing symptoms and reducing the long-term risks associated with POCOS. If you suspect you have POCOS or insulin resistance, it's advisable to consult with a healthcare professional for proper evaluation and guidance. 4. Non-alcoholic fatty liver disease (NAFLD). Insulin resistance plays a significant role in the development and progression of non-alcoholic fatty liver disease (NAFLD). NAFLD is a condition characterized by the accumulation of fat in the liver, not caused by alcohol consumption. Here's how insulin resistance is linked. Tonifold, increased lipid synthesis. Insulin resistance leads to elevated levels of insulin in the bloodstream. Insulin promotes the synthesis of lipids fats in the liver. Increased insulin levels, coupled with insulin resistance, result in enhanced lipid synthesis, leading to an accumulation of fat within liver cells. Impaired fat breakdown. Insulin normally inhibits the breakdown of stored fat. However, in the context of insulin resistance, this inhibition is reduced. The impaired ability to break down fat contributes to the accumulation of triglycerides and other lipid molecules in the liver. Release of free fatty acids. Insulin resistance can lead to an increase in circulating free fatty acids in the blood. These free fatty acids are taken up by the liver and contribute to the development of fatty liver disease. Inflammatory response. The accumulation of fat in the liver cells triggers an inflammatory response. Inflammation in the liver can lead to the progression of NAFLD from simple fatty liver steatosis to more severe forms, such as non-alcoholic steatohepatitis NASH, which is characterized by inflammation and liver cell damage. Oxidative stress. Insulin resistance and the associated inflammation contribute to oxidative stress in the liver. Oxidative stress can further damage liver cells and contribute to the progression of NAFLD. Association with metabolic syndrome. Insulin resistance is often part of a cluster of metabolic abnormalities known as metabolic syndrome. Metabolic syndrome includes insulin resistance, abdominal obesity, dyslipidemia, and hypertension. Individuals with metabolic syndrome are at an increased risk of NAFLD. Risk of cirrhosis and liver disease. If left untreated, NAFLD can progress to more severe conditions, including cirrhosis and liver disease. Role of adipokines, adipokines, which are hormones produced by adipose tissue fat cells, play a role in regulating insulin sensitivity. Imbalances in adipokines, seen in insulin-resistant states, can contribute to liver fat accumulation. Lifestyle interventions, lifestyle such as weight loss, regular exercise, and a healthy diet, are often recommended to address insulin resistance and manage NAFLD. Understanding the link between insulin resistance and NAFLD underscores the importance of addressing metabolic health to prevent and manage liver-related complications. Individuals at risk for or diagnosed with NAFLD should work with healthcare professionals to develop a comprehensive plan that includes lifestyle changes and, in some cases, medications to manage insulin resistance and associated metabolic conditions. 5. Cardiovascular diseases. Insulin resistance contributes to the development and progression of cardiovascular diseases through various mechanisms. Cardiovascular diseases encompass a range of conditions affecting the heart and blood vessels, including coronary artery disease, heart failure, and stroke. Here's how insulin resistance is linked to cardiovascular disease. Dyslipidemia. Insulin resistance can lead to dyslipidemia, characterized by elevated triglycerides, decreased high-density lipoprotein, HDL, or good cholesterol, and often an increase in small, dense low-density lipoprotein LDL particles. Dyslipidemia is a major risk factor for atherosclerosis, the buildup of plaque in the arteries that can lead to heart attacks and strokes. Increased free fatty acids. Insulin resistance promotes an increase in circulating free fatty acids in the blood. Elevated free fatty acids contribute to inflammation, oxidative stress, and damage to the blood vessel walls, initiating the atherosclerotic process. Endothelial dysfunction. Insulin resistance is associated with endothelial dysfunction, a condition where the inner lining of blood vessels does not function optimally. Endothelial dysfunction contributes to impaired vasodilation, the widening of blood vessels, increased blood pressure, and a pro-inflammatory environment within the blood vessels. Inflammation. Insulin resistance is linked to chronic, low-grade inflammation throughout the body. Inflammation within the arterial walls contributes to the formation and progression of atherosclerotic plaques. Prothrombotic state, insulin resistance, is associated with an increased risk of blood clotting abnormalities, creating a prothrombotic state. The formation of blood clots can contribute to heart attacks and strokes. Impact on heart structure and function. Insulin resistance may have direct effects on the heart, leading to structural changes and impaired cardiac function. Over time, these changes can contribute to heart failure, a condition where the heart cannot pump blood effectively. 6. Obesity. The relationship between insulin resistance and obesity is complex and bidirectional. Insulin resistance can contribute to the development of obesity, and conversely, obesity can exacerbate insulin resistance. Here's how insulin resistance can be linked to obesity. Increase in early stages of insulin resistance. The pancreas compensates by producing higher levels of insulin to help glucose enter cells. Insulin has an anabolic effect, promoting the storage of nutrients, including fat, in adipose fat tissue. Promotion of fat storage. Insulin is known to promote the storage of fat by facilitating the uptake of glucose and triglycerides into adipose tissue. Higher insulin levels, combined with insulin resistance, can lead to increased fat storage in adipose tissue. Enhanced lipidness. Insulin resistance is associated with enhanced lipogenesis, the process of converting excess glucose into fatty acids for storage. This increased lipogenesis contributes to the accumulation of fat in adipose tissue. Adipic imbalance. Adipose tissue produces hormones called adipokines, which play a role in metabolic regulation. Insulin resistance can disrupt the balance of adipokines, leading to increased release of pro-inflammatory adipokines and decreased secretion of anti-inflammatory adipokines. This imbalance can contribute to obesity-related inflammation. Impaired lipolysis. Insulin normally inhibits lipolysis, the breakdown of stored fat into free fatty acids. In insulin resistance, there is impaired inhibition of lipolysis, leading to increased release of free fatty acids into the bloodstream, which can contribute to obesity-related complications. Feedback loop. As obesity develops, especially abdominal obesity, it can contribute to further insulin resistance. The excess fat, particularly in visceral adipose tissue, secretes inflammatory substances that can impair insulin action, creating a feedback loop where insulin resistance promotes obesity, and obesity exacerbates insulin resistance. It's important to note that while insulin resistance can contribute to obesity, obesity itself is a multifactorial condition influenced by various genetic, environmental, and lifestyle factors. Addressing insulin resistance and obesity often requires a comprehensive approach, including lifestyle modifications such as a healthy diet, regular physical activity, and weight management. In some cases, medications may be prescribed to improve insulin sensitivity and assist in weight management. Individuals concerned about insulin resistance and obesity should consult with healthcare professionals for personalized guidance and intervention. 7. High blood pressure. Insulin resistance can contribute to the development of high blood pressure hypertension through various mechanisms. Here's how insulin resistance is linked to hypertension. Endothelial dysfunction. Insulin resistance is associated with endothelial dysfunction, a condition where the inner lining of blood vessels endothelium does not function optimally. Endothelial dysfunction can impair the ability of blood vessels to dilate, widen, leading to increased resistance to blood flow and higher blood pressure. Increased sympathetic nervous system activity. Insulin resistance is linked to increased activity of the sympathetic nervous system, which controls functions such as heart rate and blood vessel constriction. Elevated sympathetic activity can lead to vasoconstriction, narrowing of blood vessels, and increased blood pressure. Sodium retention. Insulin resistance is associated with an impaired ability of the kidneys to excrete sodium. Higher levels of insulin can promote sodium retention, leading to increased blood volume and, consequently, elevated blood pressure. Inflammation and oxidative stress. Insulin resistance is often associated with chronic low-grade inflammation and oxidative stress. Inflammatory processes and oxidative stress can contribute to damage in the blood vessel walls and lead to increased arterial stiffness, contributing to hypertension. Dyslipidemia. Insulin resistance can result in dyslipidemia, characterized by elevated triglycerides and decreased high-density lipoprotein (HDL) or good cholesterol. Dyslipidemia can contribute to atherosclerosis, the buildup of plaque in the arteries, which may affect blood pressure regulation. Hyperinsulinemia. Insulin resistance often leads to compensatory hyperinsulinemia, with higher levels of insulin circulating in the blood. Insulin can have direct effects on blood vessel walls, promoting smooth muscle cell growth and contributing to vascular remodeling, which may impact blood pressure regulation. Impact on nitric oxide production. Insulin normally stimulates the production of nitric oxide, a molecule that helps relax blood vessels and improve blood flow. Insulin resistance can impair this vasodilatory effect, contributing to increased vascular resistance and elevated blood pressure. It's important to note that while insulin resistance is associated with hypertension, it is often part of a broader constellation of metabolic abnormalities. Lifestyle modifications, such as a healthy diet, regular physical activity, and weight management, are crucial for addressing insulin resistance and mitigating its impact on blood pressure. In some cases, medications may be prescribed to manage blood pressure and improve insulin sensitivity. Individuals concerned about insulin resistance and hypertension should consult with healthcare professionals for proper evaluation and personalized guidance. As we close this chapter, let's remember that insulin resistance is not a one-size-fits-all issue. It's a complex puzzle with links to heart disease, obesity, and more. And the good news is that small changes in our lifestyle can make a big difference. Whether it's through adopting a healthier diet, staying physically active, or considering intermittent fasting, we have the power to take control of our health. Remember, knowledge is the first step towards a healthier future. If you found this information valuable, don't forget to like, share, and subscribe. And as always, consult with healthcare professionals for personalized advice on managing insulin resistance and improving your overall health.